morning, everyone. Our today's moderator is Trupti Rasal ma'am. She's head of nutrition department of Bharati Hospital Research Center, and she's the faculty at BVDU Medical College. Ma'am has an enriched experience of 15 plus years of experience in clinical nutrition, ICU, diabetic educator, and UGC set qualified assistant professor. Ma'am is also a consulting dietitian for lifetime member of IDA and IAPEN. And ma'am has a special interest in critical care, PCOD, weight management, and infertility, diabetic, and cardiac disorders. So, ma'am, I request you to please moderate today's session. Over to you, ma'am.
Yes, thank you, sir, for inviting me as a moderator. And this is the month of breastfeeding week. So we have completed our breastfeeding week. So we are observing the remaining month as the breastfeeding month. So as an initiative of that, our topic is really very insightful sites will be there, that nourishing mothers and nurturing the generations, because this is a need nowadays. Because unless and until the mother is very healthy, we cannot nourish the further generations. So we are seeing day by day the eating habits, the lifestyle, everything is changing. So today's session will be very useful for everyone, and many things can be changed in our daily clinical practice. So our speaker is dietitian Prachi Dekate. She is a very renowned clinical nutritionist with over a period of 18 years plus of her clinical experience. She is a gold medalist. She is a registered dietitian, a functional nutritionist. There are many things to tell. She is a diabetic educator. She is a certified IBS consultant from Monash University. She is a pediatric and surgery consultant. So there are no words to talk about, madam. So before we start, I would like to, ma'am, just give their insights. That is her topic, that is lactation nutrition decoded, because we are just talking about the milk and dry fruits, which are seeing, which is a traditional method. Wherever we go in India, we just, when we ask the patient's relatives what you are going to give, they just say ki dry fruit ke laddu denge, doodh denge, ye denge. But beyond this, there are many things that every person should know. So I please welcome the dietitian Prachi Dekate ma'am, and she will start with her session.
Trupti ma'am, thank you so much for that introduction. And I am genuinely grateful to Pollen's Healthcare that they have really taken this initiative and have collaborated with Aram, the Healing Hands Diet Clinic. And it's a wonderful platform, and we will keep going. We will be together in upgrading our knowledge in terms of community nutrition. So my topic for today's webinar is Lactation Nutrition Decoded. We are just not targeting a basic lactating mother's nutri-care. We are thinking beyond milk and dry fruits. So to have an overview, I will be covering nutrition in lactation, nutrient requirements in lactation, stages of milk secretion, benefits for mother and baby, foods to emphasize during lactation, and the key takeaways. So lactation is the nature's first and most complete nutrition. It is a period of production and secretion of breast milk that is facilitated by an interlay due to various hormones after delivery of an infant. It takes around 2 to 3 weeks to establish a feeding routine. It definitely depends a lot on the demands and supply mechanism. The more child takes, the more will be the supply. In India, we see that 1 in 3 women are anemic and calcium deficient. So proper maternal nutrition during lactation is certainly not a luxury, it's a necessity. Lactation is a biological superpower, and it is the most demanding phase in a woman's life nutritionally. So for the first 6 months, breast milk alone provides everything a baby needs to grow, fight infections, and develop the brain. Every drop of the breast, that it is the nature's first and most complete nutrition. It takes around 2 to 3 weeks to establish a good feeding routine. It it largely depends on the demands and supply mechanism. And India, we are seeing that 1 in 3 women are anemic or calcium deficient or both. So the need for proper maternal nutrition is certainly not a luxury, it's a necessity. Lactation is a biological superpower, and it is the most demanding phase in a woman's life nutritionally. For the first 6 months, breast milk alone provides everything a baby needs to grow, to fight infections, and develop the brain. Every drop of breast milk is made from what the mother eats and drinks. So good nutrition during lactation leads to better immunity, better growth, and better future for our children. Next slide, please. During this phase, the mother needs extra nutrition as she has to nourish a fully developed, rapidly growing infant. So she just not need to take care of the baby, but she has also needs to take additional nutrients for her own postpartum nutritional requirements. She has to come over from the recovery phase. And any kind of inadequacy in mother's diet influences both the quantity and quality of the mother's milk. So if the mother's diet is not adequate and not meeting her physiological demands, what will happen? Her body will draw the reserves to meet the needs of lactation at the cost of her own health. So lactating mother needs additional energy for production of milk. Approximately 600 to 850 ml milk is secreted daily. During the first 6 months, additional 600 calories per day is required, and during 7 to 12 months, additional 520 calories per day is required. Indian women's breast milk has the same protein quality worldwide. It's not affected much by mother's diet. That's a very interesting fact. It doesn't depend what kind of diet the mother is taking. The child will fulfill his demand. So for proper milk production, adequate amounts of good quality protein should be included. Protein need increases as milk contains 1.15 gram protein per 100 ml. And in first 6 months, it is 0.83 gram per kg per day, which is additional 17 gram per day. And during the later 6 months, it is additional 13 gram per day. The breast milk contains various proteins. So first is whey is to casein ratio, and it is interesting to know this fact that why mother's milk always supports the gut of the baby, because the ratio of whey to casein, it is 60:40, which is easily digestible for the infant. It is unlike the cow's milk, which is 20:80. So the portion of casein in a cow's milk is way too high. There's alpha-lactalbumin, which helps in brain development. There is lactoferrin, which helps in iron binding, and it helps in fighting the infections. There are secretory IgA, which is high in colostrum and provide immune protection to the baby. There are all 9 kinds of essential amino acids present, and they are present just in the perfect ratio to promote growth in infants. So here is a comparative chart which is showing the content of mother's milk to cow's milk to formula milk. And we are seeing the protein in per 100 ml in mother's milk is 1 to 1.5 gram, where as in cow's milk, it is 3.4 gram per 100 ml. And the infant feeding formula, it is 1.3 to 1.5 gram per 100 ml. As I have already mentioned that the whey to casein ratio in mother's milk is 60:40, which is just perfect for human baby kidneys. And Whereas in cow's milk, it is 20:80, and it is too much of protein, which is very high to digest for a child below 1 year of age. However, the infant formula, they are being adjusted to mimic the breast milk. Next slide, please. Yeah. So these are the RDA for a lactating mother during 0 to 6 months and 7 to 12 months. I hope all of you are aware about it. Next slide, please. They are the key micronutrients where we have to, as a clinical nutrition practitioners, we should be not only focusing on the macros, we need to focus on the micros also. So the micros, we need to focus on our calcium, iron, folic acid, vitamin A, vitamin D, vitamin B12, iodine, zinc, because they are the nutrients which are helping the mother to overcome from the losses and to build up good iron profile for the DNA synthesis and prevent megaloblastic anemia in the infant, to provide a proper immunity. And vitamin D has to be taken especially care of, because if it is not sufficient, you must have been aware that above 95% of the Indians, they are deficient in vitamin D. So supplementation is definitely important if the values are not in range. There should be high focus on vitamin B12, particularly to the vegetarians, because they are the group which are severely deficient in vitamin B12, and the vitamin B12 deficiency may lead to postpartum fatigue. Iodine is very important, not only for the mother, but also for the baby, for the baby's thyroid health and the cognitive development. Next slide, please. Yeah. So to continue with the micronutrients, zinc, choline, and DHA. DHA का अभी हम देख रहे हैं, everybody is going gaga with it, and definitely it shows great results when the mother's diet is proper, or if it is not there, one should be taking extra help by taking oral nutritional supplements. Next slide, please. Not to miss, to focus on fluids and the hydration of the lactating mother, because milk is in the liquid state. So the target should be 3 to 3.5 liters per day. However, it depends largely on the climatic conditions you are staying in, and also the kind of diet the mother is taking. So emphasize on the water, milk, buttermilk, coconut water, fresh fruit juices, thin dals, etc. Check for the signs of dehydration, like if the urine is dark, if the mother is having headache, or if there is a low milk. Limit tea and coffee to less than 2 small cups per day. So this is the stages of milk secretion. The first milk which comes is the colostrum, and it starts about the 16th week of pregnancy and ends about 2 to 5 days post-birth. It is rich in protein, fat-soluble vitamins, minerals, and immunoglobulins. Then comes the transitional milk. It starts about after 2 to 5 days post-birth, and it ends about 10 to 15 days post-birth. It is rich in fat, lactose, and water-soluble vitamins. And then comes the mature milk. It starts about 10 to 15 days post-birth, and it ends once lactation is discontinued. It is rich in lactose, fat, protein, vitamins, and minerals. The nature is so beautiful that it has kept the various stages of milk secretion to fulfill the child's demand during initial stages of its life. So the breastfeeding not only just benefits the baby, but it has great benefits to the mother also. In babies, it promotes infant immunity. It is very cost effective, and it nurtures the baby and mother bond. It is environmental friendly. Wherever the child is having the hunger pangs, the mother can supply, and it induces oxytocin production, which keeps the mother also happy. And it at times it is being said that it works as contraceptive. However, one should not rely on this. So the foods to emphasize during lactation. I have taken out the Indian meal plate, what we tell to our clients. So there are certain traditional galactagogues that work, like the methi seeds, 1 teaspoon of soaked methi seeds in form of laddu, or just the methi seed water, or just by adding it into your curries. After soaking, it doesn't give much, kadwa taste nahi aata hai. Then the soft. It is an amazing thing because it is not only good for digestion, it also works as a mild galactagogue and keeps the tummy happy both for the mother and for the child. Ajwain. It is gas relief for mom and baby. Then our traditional til gond and dry fruit laddus, which helps in postpartum recovery. They are just not rich in calories, but also supply micronutrients, which are very important, like calcium and iron. Ragi, which is nachni, it is also rich in calcium, iron, so it can be given in form of ragi malt or ragi roti or ragi chila. Bajra and jowar roti, I ask my clients to have over wheat chapati because they are easy to digest and they are also rich in iron and fiber. And at times, if the client is convinced, I also advise them to have garlic, 1 to 2 cloves in dal. Next slide, please. So what are the foods to limit during lactation? Of course, the caffeine thing, and because it interferes with baby sleep and iron absorption. Alcohol, fishes, and ask the client to first check before taking fishes. Then excess spices, too much of strong spices. I have seen that it may cause colic pain in some babies. Processed food is strictly no-no, and ask the client to avoid any kind of self-supplementations. Next slide, please. So the red flags where one has to see the doctor or the registered dietitian is when the baby is having a poor weight gain, where there is severe fatigue, hair loss, and depression in a lactating mother, when the cracked nipples are not healing, and when there is low milk supply despite of a good diet. So the key takeaways of my presentation today is meeting nutritional requirements during lactation is important to prevent maternal depletion, the bone losses, anemia, and fatigue. Meeting plus 600 kilocalories, plus 20 gram protein, and 1200 milligram of calcium, along with enough hydration is on the top list. Then mother's nutritional status directly impacts baby's growth, immunity, and brain development. In Indian context, high risk of calcium, iron, and vitamin B12, vitamin D deficiency is there. So lactating mother needs a good nutrition, rest, proper hydration, and family and social support. So my tagline for my presentation today is, when we feed the generation right, we nourish the next generation. Thank you so much.
Mother's milk is the best milk, we all know. So rather than just specifying only on the quantity, we should always improve the quality of the milk also. So if everyone considers these points, naturally we can improve the next generation. Thank you, ma'am. Yes.
Most welcome.
So Yes, so our next speaker is dietitian Chetna Sikhwal. So she is the consultant dietitian at Shri Bhagwan Mahavir Hospital. She has a diploma degree in dietetics and nutrition, and she's also a master's degree in clinical nutrition. And she has been awarded as the best poster presentation at the ICNC 2025, which was held at Varanasi. So her topic will be, she will be, I think, covering a case capsule where it is the topic like nourishing the two. So it will be more of an Indian dietary approach to support the lactation phase. So welcome, Chetna. So we hand over the presentation for you so you can share your insights. Welcome, Chetna.
Actually, I'll be comfortable in any language, like it will be Hindi, English, Marathi, whatever I'll be preferring right now. Okay. So basically, just a Prachi ma'am ne explain ki I'm just covering up with a case capsule. So I won't be giving the introduction and all क्योंकि मैम ने बहुत अच्छा presentation अभी दिया है. So the case is a 29-year-old lactating mother who had history of GDM and severe PIH. Her weight was 68 kg and height was 158 centimeter. Her BMI was 27.3 kg per meter square. Her dietary preferences, she's pure vegetarian. Prior to the pregnancy, she had weight of 58 kg. Currently, she is 1.5 month postpartum and is on exclusive breastfeeding. She is actually worried about her recovery and milk supply, and as well for her biochemical parameters. So these are her biochemical parameters. Like prior to the pregnancy, her HB was from 12.9. When she came to know, it was 12.9. Followed by that, as I have mentioned, she had GDM. So the fasting blood sugar was on haywire, and her, as mentioned, PIH, she had the history. Her BP was also on higher side. Here, I would like to add one thing. In the beginning of the pregnancy, she was just on Nicardia 10 mg. Followed by that, she had to take Labetalol thrice a day and plus Nicardia. So this is her postpartum into postpartum biochemical parameters. Okay, so this was her dietary recall when she had decided to breastfeed the baby, and that at time of the discharge from the hospital. As ma'am have mentioned that we usually in India we prefer like dry fruits खा लो, milk production अच्छा हो जाएगा, ये खा लो बहुत अच्छा हो जाएगा, वगैरह वगैरह. This was her dietary recall, which I updated later on. As ma'am have mentioned the required calorie intake, I have taken this from RDA. So this was her discharge dietary guideline, diet plan. As methi dana, soft, jeera, dalchini, it had also supported her weight loss. Acted as 1 minute. This have also helped her as galactagogues as well as act as boosting her BMR. So this was her mid-morning morning snack. Followed by that, as I would like to mention one thing, this is my diet plan which I followed my post delivery. So this was her throughout dietary recall. Do I need to read one to one word? I hope it is not required. Okay, so being vegetarian, I was not confident about my protein requirement will be fulfilled or not. Hence, I just added a ONS. I would not be disclaiming the name. So my major concern was to think about my iron, calcium, and vitamin D, and even about the protein intake. So nutrition goal was to meet increased nutritional requirement, maintain adequate hydration, sufficient protein and micronutrients, support maternal recovery, avoid restricted diet, make one understand that hormone cycle is needed to support your milk supply. As ma'am have mentioned previously, I won't be repeating this as well. So when it comes to like a lactating mother, many people come to visit you, like your close relatives, like they'll say, have this will happen, have that, this will happen. Nahi, nahi, ye mat khao, bachche ko ye ho jayega, wo mat khao, bachche ko ye ho jayega. I'll strictly say one thing, I have not followed any kind of restriction throughout the journey of my breastfeeding. So these are some common myths, I'll say. More ghee means more milk, then nothing like that. Special lactation foods are essential, not like that. Certain fruits, I'll like to mention example here. Few people say that don't have fruits rich in vitamin C, that will cause baby will get cold.
One more thing I came to know is like a lactating mother should not have mangoes because the baby may have loose motions and that can trigger his colic. One thing, when we soak mangoes for 2 hours and consume that, it is beneficial for baby as well as for mother because it have a good amount of vitamin A in it. So huge quantity of milk is necessary for calcium and protein come from which can come from variety of foods. So expected outcome is to have improved dietary diversity, better protein and micronutrient intake, improved meal regularity, better maternal energy and recovery, healthy postpartum weight trajectory, reduced anxiety around milk boosting foods, a sustainable eat, Indian eating pattern. So the key take message is nourishing two does not mean eating for two. It means nourishing the mother adequately so that she can nourish her baby, nourish the mother, support lactation, support infant growth. A nourished mother is only feeding her baby. She is not only feeding her baby, she is also rebuilding herself. So these are the references. Thank you. Yes, thank you, Chetna. So Chetna has presented her case study where she has covered all the points that how a meal pattern should be there for a lactating mother, because the main part, as she gave her own experience, that she had followed the same diet, because every mother post lactation, she is in a worry that how will I lose my weight and the family members are just loading me with ghee. So naturally that is a thing, that there is a becoming a positive energy balance and there is no energy as such output because our basic metabolism is on the lower side. So everyone should think that the calorie count is very essential, where we have to check with the pregnancy weight, and breastfeeding will be the best method to lose whatever weight they have gained. But we should never neglect that the calcium, protein, iron, and D3 part should also be included with a balanced lactating diet. So, thank you, Chetna, once again. So, our next speaker is dietitian Jaya Gawande. She is a consultant dietitian, she is a diabetic educator, and she is a yoga teacher. Because we usually just focus on the diet part, but post pregnancy or even in pregnancy or in the lactation phase, exercise is the most essential part, because as we age, our bone density becomes low on the lower side. The number of pregnancies, the number the amount of bone mineral density will reduce, and as we enter the menopause or the premenopause stage, it will come on the lower side. So ma'am will give us a good insights that postpartum, what care of yoga or what things should be included, where the pre and postnatal care should be taken care. So I welcome Jaya ma'am, and please share with your presentation.
My topic is yoga for healthy pregnancy, stress management, better lactation, and postpartum recovery. An evidence-informed perspective on yoga therapy across the maternal continent. Pregnancy need mind and body care because many changes are there: physical, weight gain, back pain, edema, fatigue, hormonal changes, and psychological, anxiety, mood swings, stress, sleep disturbance, fear of childbirth. Yoga address physical, mental, emotional, and spiritual dimension, so making it particularly suitable across the perinatal periods. Next slide, please. So pregnancy physiological changes during pregnancy: cardiovascular, respiratory, musculoskeletal, and endocrine system. Next slide. Fifth. Thus, physiological changes during pregnancy. Fifth slide, please. The science of yoga in pregnancy. Yoga combine asana, physical posture, pranayama, breath regulation, dhyana, meditation, deep relaxation. Documented physiological effects are improve autonomic nervous system balance, reduce sympathetic overactivity, enhance parasympathetic tone, lower cortisol level, improve sleep quality, reduce perceived stress. Research indicate that yoga during uncomplicated pregnancy can improve maternal well-being and may reduce anxiety, depressive symptoms, consist with the guidance from the major obstetric and public health bodies on safe physical activities in pregnancy. These are the few references. Next slide, please. Benefits of prenatal yoga. Maternal benefit: reduce back pain and better posture, improve flexibility, reduce edema, improve circulation, better sleep quality, reduce anxiety and depression, enhance body awareness, fetal benefits, better intraplacental circulation, improve maternal oxygenation, enhance maternal fetal bonding, and reduce fetal exposure to stress hormone. Next slide, please. Few yogasanas, common symptoms in pregnancy, nausea, fatigue, emotional fluctuation, breast tenderness. Recommended practices, Sukhasana, easy pose, Vajrasana, thunder bell pose, Marjari Asana, gentle cow, cat and cow pose, Tadasana, mountain pose with support, gentle neck and shoulder movement. Some pranayamas. Avoid deep twist, strong abdominal contraction, inversion for beginners. Next slide, please. No, previous slide. Yoga during pregnancy, easy pose, cat cow pose, benefit, reduce stress, anxiety, lower back pain, improve circulation and sleep quality, build strength, balance and pelvic stability, support calmer, more controlled breathing, self-practice tips, use prop, block, belts, chairs, wall, move slowly, prioritize stability over depth, practice pranayama, consult your doctor before standing asanas, avoid deep twisting or strong abdominal contraction. Inversion, especially for beginner, laying flat on the back after first trimester, hot yoga, overheating, and breath holding means kumbhak. Next slide, please. Pranayama during pregnancy, diaphragm breathing, anulom vilom without breath retention, Brahmari pranayam, Ujjaini gentle, Chandranali breathing. Benefit, reduce anxiety and stabilize heart rate, improve oxygenation, promote parasympathetic activation, useful during labor contraction. Avoid Kapala Bharati, Bhastrika, long breathing, retention, Kumbhaka, forceful pranayama. Even मेरे कुछ ऐसे ये है जिनको नौशिया मॉर्निंग सिकनेस होता है, उनको प्राणायाम से बहुत ज्यादा बेनिफिट्स मिलता है, स्पेशली एसिडिटी एंड मॉर्निंग सिकनेस. नेक्स्ट स्लाइड प्लीज. Pranayama postures, Sukhasana, easy seated pose, Thrumbal pose, Vajrasana, Adham Pranayama, Anulom Vilom, Hummingbee, Brahmari Pranayama, Ocean breathe. Next slide, please. Stress management through the yoga. Next slide. How to stress affect pregnancy and how yoga help. Common stress triggers, fear of miscarriage, financial concern, relationship changes, work stress, body image concern, childbirth anxiety. The HAP axis response, stress activate the hypothalamic pituitary urinary axis triggers, cortisol release, adrenal and non-adrenal surge, heightened sympathetic fight or flight tone. Chronic maternal stress may influence sleep quality, blood pressure, emotional well-being throughout the pregnancy. How yoga reduce stress, lower cortisol level, increase vagal tone and HRV rate variability, reduce inflammatory markers, improve emotional regulation via slow breathing, mindful movement, meditation, deep relaxation, and positive affirmation. Most important things is positive affirmation and few positive thoughts in the morning or bedtime reading. Yoga for labor preparation. Previous slide, please. 14 number slide. Yoga for labor preparation, physical preparation, pelvic mobility, hip opening, leg endurance, postural alignment, breathing technique, slow rhythmic breathing, enhancing exhalation force breathing, Brahmari during contraction, visualization breathing, mental preparation, acceptance, confidence, fear reduction. I saw many patients feel anxiety and stress during labor pain. Yoga help them to prepare their body and mind also for the normal delivery and accept whatever means condition जो है उसको accept करके happy and healthy delivery. Next slide. 16 number slide. Understanding 16 number. Next please. Next. 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 Understanding lactation physiology. Prolactin drive milk production secreted by the enteroid pituitary gland, rise in response to sucking and infants feeding cues. Oxytocin trigger the milk ejection, let down reflux, support emotional bonding between mother and infant, promote uterus contraction after birth. Why this matter clinically? Stress can inhibit the oxytocin mediated let down reflex, making stress reduction directly relevant to breastfeed success and giving yoga a clear physiological retention in lactation support. Next slide. Yoga and better lactation. How yoga help indirectly reduce stress and anxiety, improve sleep quality, enhance oxytocin release, improve posture during feeding, reduce neck and shoulder tension, increase maternal confidence. Recommended postnatal practices: gentle chest opening, shoulder roll and neck stretches, support seated posture, diaphragmatic breathing, Bhramari pranayam. Next. The postpartum period during first 6 weeks recovery continue for several months. The gradual return to physical activity is recommended for uncomplicated birth. Common challenges: fatigue and sleep deprivation, perinatal pain, cesarean recovery, breastfeeding difficulties, mood change, pelvic floor weakness. Goal of postpartum yoga. First 6 weeks, early phase: rest, breath awareness, pelvic floor activation, gentle mobility, emotional support. 6 to 12 month, intermediate phase: core rehabilitation, hip and back strengthen, posture correction, flexibility like a cat and cow pose, sukhasana, breathing practices. Next, 3 to 12 month, late phases: functional strengthening, endurance, weight management, stress reduction, confidence restoration. Next slide, please. Yoga after cesarean, important, begin only after medical clearance. Early focus: gentle breathing, ankle pump, shoulder mobility, walking and relaxation. After healing: pelvic tilts, cat cow, supported bridge, gentle core activation, scar awareness and posture correction. Avoid intense abdominal exercise initially. Progress gradually, guided by the healing and clinical clearance. Next slide, please. Postpartum mental health, baby blue, common temporary and emotional lability. Postpartum depression symptom: persistent sadness, loss of interest, sleep disturbance, guilt and fatigue, poor bonding, uh, thought to of self-harm, medical emergency. Role of yoga: may serve as a useful adjustment therapy for mood improvement, stress reduction, and social support alongside professional care. If symptoms persist beyond 2 weeks or involve thought of self-harm, promote referral to the qualified healthcare provider is essential. Next. Next slide, please. Safety guideline: practice only with medical approval. Stop immediately if vaginal bleeding and amniotic fluid leakage in pregnancy, dizziness or severe headache, chest pain, painful contraction, decreased fetal movement, shortness of breath before exhalation. Avoid hot yoga and hot pellet, contract sports, high risk balance poses, deep back bending, forceful pranayama, overheating, and false risk. Mindful motherhood is a journey. Healthy pregnancy, reduce stress and anxiety, improve labor preparation, enhance breastfeeding, fasten postpartum recovery, stronger mother and infant bonding. When a mother breathes with awareness, she nourishes two hearts. Thank you. Here are few references. I think you use different slide. Thank you.
Thank you, Jaya ma'am. Beautifully, you have shown which exercises are to be done in the prenatal phase also and postnatal also, which is very essential because the pelvic muscles get weakened as we age. So it is better to start from the prenatal phase until the postnatal. So previously also I mentioned that the bone mineral density we have to maintain So for that, a muscle strengthening is very important, whether you have undergone a cesarean section or a normal delivery. But it should always be will be the with a consultation of a certified yoga teacher and not by or on their own. Because if any muscle gets strained, that will be more painful, because there is epistemic stitches, the cesarean section when is going to get healed, that will be explained by a proper gynecologist and by a certified yoga teacher. So we have done all with the presentation. So we are open up with the questions for for our speakers. So the audience can put their questions. So we are ready. Any questions from the audience side? So, ma'am, Prachi, ma'am, I have a question that many times I have heard that there are many myths, as you have covered, that we usually focus on protein-rich foods in the diet. But being some people are pure vegetarian, and when we insist to have curd or buttermilk, their first question is, "Unko sardi ho jayega." So, how can we tackle with such clients? It is not the mother; it is the relatives which are asking.
Yes. So India में ये सारे myths बहुत prevalent है, and somehow over the generations few myths are also still being practiced. So they are there in every Indian home. Even if the lactating mother is qualified, but there is lot of social pressure कि ये हो खाने पर बच्चे को सर्दी हो जाएगी, खांसी हो जाएगी या लूज मोशंस हो जाएंगे. So there is no background and there are no evidences, scientific evidences which supports कि दूध या दही खाने से बच्चे को कुछ प्रॉब्लम होगा या मदर को रिकवरी में, जैसे टाके गीले रहेंगे if the C-section has been done, या रिकवर नहीं होगी मदर. So there is no scientific evidence to support this. And if the mother is vegetarian, there are n number of ways where being a clinical practitioner we can fulfill her protein requirements depending and taking care of her food sensitivities, their ethnical beliefs, and definitely the various comorbidities, because nowadays I am seeing invariably the pregnant lady or the lactating mother, they are having some gut issues,
Yes.
or they are complaining, they are having certain kind of comorbidities. So where it is highly personalized approach, so ये platform पे where we are practicing clinical nutrition, I would just say that I would just debunk this myth that the milk and the milk products are not allowed.
Yes. And the basic myth is कि don't give rice ताकि heal नहीं होंगे. Many things are being avoided.
Yes.
Don't give fruits. Don't give milk products. So
And there is so much of restriction, then the mother herself feels lost कि क्या खाऊं मैं.
yes. And postpartum, she has to first come out of her own pain, whether it is a cesarean section or she has undergone a labor pain of more than 12 hours.
Yes.
So first, the physical healing is important, and then the mental healing, because as ma'am, Jaya ma'am had showed that the oxytocin and prolactin part. So that is a positive loop. If there is a negative loop in between, naturally the milk secretion is going to reduce, and the kid will go on the infant formula feed, because we are focusing on exclusive breastfeeding for the first 6 months.
First 6
Later
months.
until the 2 years, because we all know the benefits of first 1,000 days. So everyone should read about first 1,000 days. Okay.
Definitely.
So Jaya ma'am, one question to you, that when can a mother start exercising to strengthen her core? Core strengthening basically.
Ma'am, please repeat your question.
Ma'am, my question is that when should a mother start core strengthening? Whether she has undergone a delivery, she has undergone a cesarean or cesarean section.
After healing process, ma'am, minimum 3 months. Core
Okay.
strengthening exercises. Okay,
Okay.
light exercises, warm up exercises, little walk, pranayama. Second, do but core exercise, especially pelvic exercises.
Yeah, pelvic.
Uh,
So, any
pelvic.
insights about Kegels exercises which are given post delivery? Kegels,
Sorry.
Kegels exercises for pelvic strengthening. So, when
Yes,
can they start?
after 3 months.
After 3 months.
After 3 months.
Okay, ma'am. Thank you so much. Any questions from the audience, please?
Hello, ma'am.
Yes, yes, Sanika.
Ma'am, can you suggest some foods which increase milk production?
I have covered in my presentation, Sanika, the galactogogues.
Okay.
I have covered that in my presentation. So, to repeat it again, like the methi dana, which can be given in water form, or it can be put in the sabji, or it can be made into powdered form and can be added to dals, or ajwain and soft water. Then there are fruits like papaya also increase milk production. And definitely it is just not the things which we should not only be focusing on the galactogogues. It is overall nourishment and nutrition for the mother, Sanika, wherein we have to not only take care of the macros, we need to focus on the micros as well. And at times, we have to go for the supplementation part.
Yes, ma'am.
Yes, any questions more?
हेलो मैम, मुझे एक क्वेश्चन पूछना था। एक्चुअली ड्यूरिंग ब्रेस्ट फीडिंग कैफीन पूरी तरह से बंद करना होगा या उसका कुछ डेली लिमिट है कि उस तक हम ले सकते हैं? क्योंकि किसी किसी को बहुत पसंद है, वो हम पूरी तरह रेस्ट्रिक्ट करना पॉसिबल नहीं होता उनके लिए, तो क्या उसके लिए कुछ डेली लिमिट्स है?
Janvi, are you asking me or Trupti ma'am? You're asking me, Janvi?
कोई
Yes.
मुझे जस्ट आंसर चाहिए, कोई भी चलेगा,
हाँ,
प्राची मैम, ट्रुप्ति मैम, एनीवन.
As it is rich in caffeine, right? So caffeine, जैसे मैंने अपने presentation में भी cover किया था, it should be less than 2 small cups per day, right?
All right, ma'am. Thank you.
Because caffeine is a brain stimulant also, no?
Yeah, it
And
is
already
a
there is sleep deprivation.
Yes.
Better you limit the tea and coffee intake if you feel little bit heavy-headed, as ma'am told, not more than 2 small cups per day.
And they work as diuretics also. You keep going to washrooms, and the inside story is you will be dehydrated.
Hello. Hi, Prachi.
Hi, Manisha. Tell me.
Actually, we have one patient, and she is a CKD, and she is pregnancy, I think 23 weeks. So, what shall we do? Because dialysis is going on weekly, thrice the time or like this, na? So,
See, Manisha, this is a very complicated case, and we have to meet up. We have to first follow the renal protocol. So on which stage she is? At what stage she
23 weeks AMC.
23 weeks.
CKD, CKD is second stage.
Second stage, okay. So आपको protein पूरा properly calculate करना है as per the GFR also, and as per her albumin profile also, and just see the urinary losses also. So somewhere around, is she gaining proper weight?
Yeah, she is gaining proper weight, but food liking is, sometimes she likes on, sometimes she feel nausea feeling. So
Yeah.
nowadays she is not taking anything. Like she's taking sometime milk only, or sometime taking like khichdi type thing, not taking proper meal, like complete meal, na?
Okay. So, for such patients, a single meal like, a paratha where it is made, instead of water, it is made from dal, you know,
Hmm.
जो
Mm-hmm.
हम लीचिंग पूरा प्रोसेस करते हैं किडनी पेशेंट्स के लिए, तो
Yeah.
लीचिंग करके ओवरनाइट सोकिंग एंड प्रॉपरली कुकिंग के बाद
But there is a dialysis also, na? So this is a very difficult, na? So we'll give high protein, or it's moderate, or it's like
she
it's
is in
lower
stage
side.
2 and she is
State
on
two, yes.
dialysis.
Because some circumstances is there, na?
So
So
she is in
doctor is
under
doing.
AKI, Manisha, or she is on proper HD?
No, not proper HD, but last week mein 3 times हुआ था, this week 1 time, the next week they are planning 2 times, like this.
I think we should be sitting together with the nephrologist.
We also sit and talk to them, and
Then
he said
definitely
it's
her
48,
calorie
it's
demands are
48
high.
gram per day,
Huh.
like this, not more than that, na? Because
Yeah,
AMC is there, so we can't,
give below
reduce the
40
proteins
grams.
also.
Yeah.
Yes.
Yes. And
Hmm.
you have to, give her enough calories to
Hmm.
spare protein.
Okay.
You have to give
Hmm.
her enough calories to spare
Hmm.
protein, and then give her good amount of fats. So uska thoda sa, I think 10 to 12%
So
protein.
MCT oil is okay, or something else?
No, we have to target the holistic approach, Manisha.
Okay. ठीक है.
So just do not go on the give जैसे extra virgin olive oil over the salads and flaxseed oil. अगर उसे digest हो रहा है, depends कि उसका कैसा smell है, because this needs high individualized approach.
Okay.
You connect me on personal. I think we can discuss better.
Yes, ma'am. Okay. Definitely. Definitely.
I
Thank
can
you
give
so much,
some
ma'am.
input in this.
Mhm.
That she must be having fluid restriction, right? Because she is on
Yeah, definitely.
dialysis.
1.5,
Yes.
1.5.
1.5.
Nowadays,
So,
1.5 liters.
so on her body weight, you will naturally calculate the protein. So with the fluid restriction, you will select a ONS, which will give more calorie in less volume restriction. So you can cover her pregnancy protein requirement also. Because in second stage kidney disease, still she's on dialysis, that you have to check with the parameters also.
No, actually, what is happening? The client is having a lot of nausea, and what I have observed, Trupti, they flatly deny the oral nutritional supplements
Yes, correct, Prachi.
because
Yes.
of that. Yeah, of smell. So, आप है ना, Manisha, if the patient is non-vegetarian or if they get convinced, so
No,
albumin can be
vegetarian.
added.
She is a vegetarian.
Okay.
Mm.
I think you connect me on personal. I would be.
Okay,
I
ma'am.
would help you.
Mm. Okay, Prachi, ma'am. Okay, thank you so much.
Most welcome. Any other question?
Any other questions from the audience?
Hello, ma'am.
I have, yes, Deepak, please.
Yes, ma'am. Good evening.
Good evening.
Hello. Ma'am, in pregnancy period, how much protein quantity in a daily nutrition in pregnant lady?
दीपक, आपने शुरू से प्रेजेंटेशन अटेंड किया है मेरा?
Yes, ma'am. किया था थोड़ा, हाँ, in network issue में लग गया हुआ था।
Okay. So, प्रेगनेंसी में उसका जो प्रेग्नेंट लेडी है, इट इज हाईली इंडिविजुअल अप्रोच. हम लोग पर्सनलाइज्ड डाइट प्लान बनाते हैं, तो उसका हाइट और वेट के हिसाब से उसका जितना प्रोटीन रिक्वायरमेंट है उसमें हम प्लस 15 to 17 ग्राम प्रोटीन हम ऐड करके देन वी मेक द डाइट.
Okay. Thank you.
I have a question to Jaya madam. Jaya ma'am is still there?
Yes, madam, please.
Yeah, Jaya, I have seen that, postpartum depression cases have suddenly gone up. And
Yes.
one of my client, she is a judge. So she herself was facing this after giving birth to her baby boy. So how to target this issue, because such cases are now being seen a lot, that postpartum depression बहुत ज़्यादा देखा जा रहा है अभी commonly.
Actually, I have seen many patients who suffer from the depression after delivery and labor. मैं हिंदी में देना चाहूंगी इसका आंसर. देखो
Yeah, please
कैसे
go ahead.
होता है, हम लोग कैसे है कि एकदम से ऑल ऑफ सडन सब कुछ चीजें, प्रेगनेंसी पैम्परिंग, देन करियर, कॉलेजेस, सब कुछ स्टेजेस पार करके हम जाते हैं प्रेगनेंसी. एंड प्रेगनेंसी में बहुत ज्यादा पैम्परिंग. नाउअडेज हम लोग देखते हैं कि इतना ज्यादा पैम्पर्ड प्रेगनेंसी होती है कि जो बोलोगे वो हमें खाना है, जो जितना बजे चाहोगे, 10, 11, 12, समटाइम रात के 1-1:30 बजे जो सो कॉल्ड है कि हमें ये खाना है. एंड वो अभी अभी ऐसे होता है कि वो फुलफिल भी किया जाता है. एंड आफ्टर डिलीवरी, पोस्टमार्टम पीरियड, बहुत सारे एकदम से रिस्ट्रिक्शन है, बहुत ज्यादा चेंज हुआ है. एक रिस्पॉन्सिबिलिटीज हमारे ऊपर आती है न्यूबॉर्न बेबी की. एंड हमारी फिजिकल एंड मेंटल रिकवरी एज वेल एज एक इन्फेंट, एक फीटस की रिस्पॉन्सिबिलिटी. सो फर्स्ट है कि ये एक रहता है हमारे माइंड में. देन सेकंड कि कंप्लीट एडेक्वेट रेस्ट नहीं मिलते हैं. सो ये रेस्ट भी एक ट्रिगर करता है स्ट्रेस को. एंड अगर स्ट्रेस बहुत ज्यादा होता है तो डिप्रेशन आता है. देन रिलैक्सेशन प्रैक्टिस प्रॉपर से नहीं होती है, पर्सनल टाइम नहीं मिल पाता है. ये सारी चीजें हैं डिप्रेशन की. एंड जैसे मैंने बोला था कि कॉर्टिसोल है, जो स्ट्रेस हार्मोन है, वो सिक्रेशन होते हैं. एंड अगर उसको प्रॉपर से हैंडलिंग हुआ तो ये फेज हम लोग मीन्स इसमें रिकवरी मिल सकती है. बट मैं भी बहुत सारे पेशेंट ऐसे हैंडल करती हूँ कि जिनको ये, बट पॉजिटिव अफर्मेशन, ब्रीदिंग प्रैक्टिस, ये सारी चीजें हेल्पफुल रहेंगी.
Okay. So the social support, I would say, plays a great
सोशल
role.
सपोर्ट, फैमिली सपोर्ट, एंड ज्यादा अगर रहा तो प्रोफेशनल हेल्प ऑल्सो.
Yes.
Thank you, Jaya. Thank you, Prachi.
Thank you so much, Trupti.
So if there are no more questions, can we end up with the session? Tabish sir?
Yes, ma'am. There is no more questions in the chat box. And thank you so much for your valuable insights. All of you are the excellent speaker and a very nice moderator we have. She has asked a very relevant questions, and just wish you all the best for next webinar, which we are going to have soon in our September Nutritional Week.
Yes.
So we definitely would like to see all of you there also. And all the insightful, we are trying to give best of the best for the nutrition, as we have a certain nutrition powders with us. And yes, everyone knows those things, so need not to repeat it to her. And thank you everyone for connecting over there and giving your valuable insight and time and making this webinar such a wonderful webinar for us. Thank you so much.
Thank you so much, sir, Pollen Healthcare and Aaron, for giving us this opportunity to present in front of all the audience. So we will be looking forward for the month of September, which is our own very nutrition week, that is from 1st to 7th of September, and later on it will be the Poshan Maha. So we can take such many more activities and we can spread our nutrition knowledge throughout.
Thank you so much, Trupti,
Yes,
for
sir.
being such a nice moderator. You have done an amazing job. Thank you, Tabish sir, and the Pollen team for giving us an opportunity and making it a wonderful platform where we have joined the hands together for the upliftment of our clinical nutrition knowledge. Thank you so much, and thank you so much everyone to join today on this Friday evening. Thank you so much.